Toga.
From our chairman of the Victim Support Fund, General Danjuma, who's unavoidably absent. He would have really liked to join us here today, but for the lockdown, there's very minimal movement at this time. I'm here with my fellow colleagues, my colleagues from the Victim Support Fund, other members of the task force, namely Ambassador John Ghana, Professor Sunday Ochocha, who's the Executive Director of the Victim Support Fund, Malam Al-Qasim Abdul-Kadri, who's our spokesperson and a member of the board of the Victim Support Fund as well, Professor Nanatanko, the Director of Programs that many of you perhaps already know of the Victim Support Fund. Two of our other members, Dr. Bula Magubio is in Maiduguri waiting for us. He's going to be joining us for the flag of the and Elder Sondo Ibe, one of the other members of the task force, would also perhaps join us in other locations before we're done. This is an emergency intervention of the Victim Support Fund in the wake of the COVID-19 pandemic. I'm sure many of you have been hearing of coronavirus around the country, and at the very epicenter of this are citizens who are unable to go to work because they have to be able to observe and obey the presidential directive of a lockdown, which is in order because if you look at the trail of transmission of the virus and deaths across the different countries within Europe and America, what you find is that if you do not curtail the human-to-human transmission of that is dependent on movement and huge human mobility, you would find that the pandemic will spread, and we all know the challenges that Nigeria does have with fixing our health management infrastructure, making sure that at the local community levels like this one, we have rapid response systems to be able to ensure that the pandemic doesn't spread and we don't lose a lot of citizens. So the Victim Support Fund is Nigeria's first private sector-led humanitarian initiative, and our work and our terms of reference specifically focus on internally displaced persons and vulnerable people, the poorest of the poor in different parts of Nigeria. People that perhaps other people have forgotten about. We care about you folks. You people are legitimate members of Nigeria. And while all of the palliatives are going on, we think that it's very important that we don't forget people like you. You are part of us as Nigeria. And we're glad that we're able to provide this intervention. It's a 1 billion naira fund, and we're going to be focusing on providing food supplies. For the north here, we're going to be giving rice, beans, maize. We're going to give you salt and vegetable oil. We're also going to be giving you medicine. And under medicine, we classified it into primary and secondary care. So you get pain medicine, you get multivitamins to boost your immunity, you get anti-malaria so that you don't fall sick, and you get oral dehydration solutions for the babies, for you folks who have children. Under secondary care, we're going to be providing you anti-diabetes and anti-hypertension. Hypertension because, research has shown that this coronavirus, more people above the age of 60 are susceptible to it. And so we need to be able to make sure that we can check blood sugar and hypertension in our old men and women within the IDP communities of Nigeria. Finally, we're also going to be giving you essential hygiene products. So we'll give you jik, disinfectant, to be able to make sure that your surfaces are clean constantly. Please use them. We're also going to be giving you Dettol liquid so you can bath with them. We're also going to be donating hundreds of thousands of tablet soap so that you can wash your hands. Hand washing is the singular most powerful preventive measure. You must wash your hands constantly. And we are not just talking to you about it. We will give you the soap with which you're going to constantly be washing your hands for at least 20 seconds so that any virus does not stay. For the healthcare workers, we're going to be giving face masks like this one. We're going to give gloves, safety goggles. We're going to give our boots so that we can support our healthcare mechanisms across the country. In this preliminary intervention, we're going to be focusing on Lagos, FCT here in Abuja, and we're going to be going to Ogun State because those are the 3 frontline COVID-19 states. And then we're going to focus on the Northeast. This afternoon at 1 p.m, once we leave there, we're going to Maiduguri. So we flag off and make the donations to Maiduguri as well. Tomorrow we're going to be in Yobe State. Day after tomorrow, we're going to be in Lagos. In the morning at 10 a.m, in the afternoon, we'll be in Ogun State. On Friday, we return and go off to Jalingo in Taraba, and then go off to Yola in Adamawa State. So that's the focus of this preliminary intervention. And once we finish the preliminary intervention, with the approval of General T.Y. Danjuma, we may decide to go and support other states of Nigeria who have COVID-19. We want you to know that we are with you. The Victim Support Fund is with you. Our task force is with you. Whatever support you need, we have a competent administrative team at the VSF, led by Professor Sunday Ochocha and Dr. Nana Tanko. Our office is in Maitama. You can always reach out to us. Please, these items is not for one person. It's not for one person to collect 50 and keep it, and other people are hungry. Let us be better. This is a private intervention from the Victim Support Fund. It doesn't have one dime of government money in it, where government happens to be our key partner in the implementation of this process, because all of us have to get to work with government and support the effort of the government to be able to intervene in this process. So we wish you well. We pray that COVID-19 leaves Nigeria very soon, and all of you can return to work and go back to your normal life. Thank you very much. Households across Nigeria. Cumulatively, that would run into hundreds of thousands when you think about the fact that an average Nigerian family has a man, a woman, and children, and also extensive dependents. I also wanted to mention that everything we're giving you, the rice is 10 kg, the beans is 10 kg, the maize is 10 kg, the vegetable oil is 4 liters, and the salt is 2 kgs. At least for an average Nigerian family, that should keep you for another 2 weeks to 4 weeks, before we then hope that all of this will come to you. Thank you so much for having me.
Distinguished members of the press, ladies and gentlemen, I stand here on behalf of the Honorable Minister of State for the FCT, Dr. Ramatu Tijani Aliyu, who would have been here personally, but due to exigencies of work, she asked me to come and represent her and apologize most seriously for her not being here. Yesterday, we have been on this program, liaison with Professor Nana and talking to the Honorable Minister, and she tried as much as possible to see how she can squeeze the program. Unfortunately, 2 of her functions this morning cannot be delegated. One, and so she asked me to convey our most gratitude on behalf of the people and the government of the Federal Capital Territory for this marvelous support. Indeed, this is the first time since COVID-19 that the FCT is receiving such a marvelous donation from the private sector. And she asked me to convey her gratitude. As the chairman of the task force also for the FCT, she has made a very elaborate plan on the distribution of palliatives that will not leave any vulnerable unattended. There are a lot of structure, the organogram, which started from the ministerial task force down to the ward level, whereby all the communities are involved, all the civil societies are also represented, religious leaders are represented, youth leaders and women leaders are also represented, and the distribution is also going to be door to door. There's not going to be gathering in one place because of the protocol of the social distance. And so I want to assure the VSF that whatever that is given is going to be distributed judiciously. And all the beneficiaries of this support, especially the IDPs, the other vulnerables and the poorest, poor and the poorest in the community are going to be benefited. And it's going to be transparent because we will ensure that everything is fully documented with video, photographs, and I'm sure the representative of the VSF are going to be always with the distribution team to ensure that this has reached the targeted audience. I don't want to take much time with these few remarks. I would like to, on behalf of the Honorable Minister, declare this support distribution and flag it up for the benefit of the vulnerables and for the glory of the Almighty God. Thank you.
Let the truck behind show the...
Presentation now. Presentation.
Find out if these items were actually distributed. We definitely have a lot of trust in the administration of the FCT and the chairman of the representative of the minister as mentioned. But it's also important for us to say that because of the integrity of the VSF and the fact that the media knows that 1 billionaire is involved, it's very important to us to monitor, evaluate, track, and report this process to the public in a way that people know that this is how we spent the money, and these are the people that received these items that we brought out. So all of you are going to get. Don't sell the beans, don't sell the maize, don't sell the oil. Give it to your wife to cook. COVID-19 task force. And a member of the Victims Support Fund, forgive me. That person is evil. Components of members of our society. As you know, the terms of reference and the mandate of the VSF is to focus on rehabilitating victims of insurgency in the Northeast, to return normalcy to the Northeast, to build sustainable systems and foundations that will power the economic revival of the Northeast, and help children whose parents have been killed by insurgents to return to school, farmers whose farmlands were destroyed to be able to recontinue their businesses, women who've become widows to be able to get some form of economic empowerment, government infrastructure that has been destroyed to be rebuilt. In the last 6 years, we've rebuilt police stations, local government secretariats, we've rebuilt hospitals, we've built healthcare centers, we've supported the Nigerian army, we've donated fertilizer to farmers, we've done women economic empowerment programs to more than 30,000 women across various communities in Borno, Adamawa, and Yobe states. And so that's pretty much, those are the sort of humanitarian work. By the way, the Victim Support Fund is the first private sector-led humanitarian initiative in Nigeria. And in the wake of the COVID-19 pandemic, the most sensible thing to do, the most humane thing to do, is that while everybody is trying to take care of themselves because of the lockdown, it was only an imperative for us at the VSF, with the approval of our chairman, General T.Y. Danjuma, to flag off intervention, sustainable emergency intervention programs across the Northeast. But more than that, also focus on supporting the frontline COVID-19 states, being Lagos, Ogun, and FCT, For the northeastern states, we're going to Taraba, we're going to Adamawa State, we're going to be going to Borno, we're going to Yola. And those are the 7 parts of Nigeria that we're going to be focusing on for the preliminary intervention. Monitoring and evaluation is very crucial for us in this process. You've been seeing Nigerians complaining that all the food that is being shared is not getting to them. Where are this food we're talking about? But the VSF, as you can see, has a very coordinated response plan and strategy to not just distribute the food items, but to monitor and ensure that the items get into the hands of the actual IDPs, vulnerable persons, poor people, and deprived persons within our country. Thank you so much.
Honorable Minister of State, Dr. Ali. Having planned to also flag off the distribution of palliatives to all the vulnerables in the FCT, and we are hoping to process from far away Abaji down here. So we are just at the stage of making sure that house by house, and every house that they receive, are going to be fully documented. And I have also advised that they should also mark the houses so that at the end of the day, you can come round and check. If you see any marked house, ask them if they have received and what they have received. And this is going to be done throughout the next 5 days to finish up the distribution of the items brought by the VSF. So there is going to be transparency and accountability in this case.
Vulnerable people, urban and rural poor people within the community. We're hoping that this will be distributed, and as I've already told the officials of the FCT FEMA, we have a robust monitoring and evaluation plan in place to be able to be sure that we would come back and work with anonymous agents in the communities to ensure that these items reach the people that wanted to reach. They were not resold or rebagged and resold, and they were not circumvented and handed over to just a few, concentrated in the hands of just a few privileged people. That's pretty much all. Thank you very much.